This is week 15, which is chapter 17, and it's actually the first part of chapter 17, and we deal with healthcare. So what we're doing here is, well, we'll get started. We'll answer the questions. So let's get started. The first question is, what are the problems of the healthcare system? And essentially, I've listed a number here. First of all, it costs too much. It's very, very expensive. Doctors, hospitals, testing, you go in and they want you to get an MRI or whatever they want you to get. The procedures, whatever they decide, and the drugs, they're almost always going to be very costly, no matter what it is. It's not uncommon these days to see somebody at Walgreens or Walmart or someplace getting drugs, and they're getting a whole bunch of drugs, different drugs for different problems that they're suffering, especially older people like me. And the end result is it's not uncommon for them to be paying in excess of $100 or so for even just one prescription. It's just unbelievable. A hospital stay can wipe you out if you have to stay in the hospital. You have to have insurance, and even with insurance, it's difficult. So anyway, the cost is way too high. And the second thing is that the cost appears to be going up all the time. For example, a doctor's visit used to be, when I was a kid, a doctor's visit would be about $25, $30. And now it's at least somewhere in the neighborhood of at least $100. And of course, the doctor only sees you for a few minutes. But the cost just, in all these costs, not just the doctors, but the hospitals, the testing, any other procedures you might need, and drugs, all of that's going up, and it just seems to be going up all the time. It doesn't seem to ever reach a peak. It just keeps escalating. Number three here is that the system isn't working very well. We're not getting much of a bang for our buck. Most people are not very well off in terms of their medical health. We're getting more and more obese. We're the fattest people walking the face of the earth. We don't seem to know much about how to take care of ourselves, and whether you go to a doctor and get the prescriptions that are given to you, I mean, drugs or whatever, there's no evidence that any of that makes your life any longer, that you live any longer, or more importantly, that you live well. Conventional medicine, next one, conventional medicine focuses on testing and intervention. Intervention means things like operations and, of course, drugs. So that's what it's really all about. When you go to a doctor, the doctor will say, I don't know what's wrong with you. We've got to do a series of tests, or we've got to do tests, blood tests, and so on. And then if the tests show anything, then the possibility is either drugs or an operation will probably be what is advocated. That's conventional medicine in a nutshell. Back in the day, doctors used to be able to tell what was wrong with you without all this testing. That was the whole thing of what separated one doctor from another. I don't know if you ever saw that television show House, but House was like that. He was an old-fashioned doctor, at least in the episodes that I saw, and I only saw maybe one or two. In the episodes I saw, he was very good at diagnosing people by examining them. But in this world, it doesn't work like that. Most doctors really don't. They just really don't want to give you any indication of what's wrong with you. Most doctors, I would say, without having tests to back it up. It's like um, they're all practicing uh, a form of protecting themselves. It's maybe due to all the suing that goes on, the lawyers suing doctors, medical malpractice, and all that kind of thing. They're covering themselves. So that's the problem, and it's very, very costly. All of that stuff is costly. One time I was having a pain. I'll give you an example. One time I was having a pain in my side, and so the doctor, I went in to the doctor, and I said, I'm having this pain. It was on the same side as my appendix. So he said, I don't know what's wrong, but I'll send you in for an MRI. They can do an MRI on you. Well, I don't know what he wrote down or what they translated what he wrote down, but they wanted to do a complete MRI on my whole body, like a body scan going from the top of my head to the tips of my toes. And I said, no, I'm just supposed to get my side examined. That would have cost, I don't know, somewhere between $3,000 and $6,000 for that test. So it gives you some idea what happens. And without that, he couldn't figure it out. Well, it turned out to be nothing, but at least nothing that would show up on a test. Another thing is that most healthcare coverage is limited. Almost everybody who's got healthcare, and now that I'm older, I'm in Medicare. That coverage that you get in Medicare is pretty limited. Before I was in it, I thought that what it would do would be it would cover all my doctor's bills. But of course it doesn't. You have to buy supplemental insurance so that whatever Medicare doesn't cover, the other insurance will pick up. And then that becomes pretty expensive because you have to buy separate coverage for doctors and hospitals, and then separate coverage for dental, and so on, whatever you think you need. Another problem with the healthcare system is that hospitals have become dangerous. They're really dangerous. It's dangerous to stay in a hospital for two reasons. One is mistakes are made all the time by doctors. I mean, some of the recommendations you get is like if they're supposed to operate on your left arm, make sure before they put you under, you have a magic marker or something on the arm that's supposed to be operated on, that kind of stuff, because oftentimes they'll operate on the wrong side, or there's all kinds of horror stories. All you got to do is look online. And then the other thing is infection, and that's becoming a big problem these days, that you can get these infections in the hospital because of, the biggest problem is that antibiotics, you're susceptible when you're in the hospital, if you're there for an operation or any long stay, you're susceptible to whatever is floating in the air or on the floor or whatever. And so the problem is that if you get an infection, antibiotics don't seem to work anymore because so many people are eating antibiotics every day, especially if you eat chicken. It's loaded, chicken, turkey, and all those birds are loaded with antibiotics. The American Medical Association keeps asking the farmers to stop doing that, but they're doing factory farming where all these animals are kept in confinement. And if you didn't give them antibiotics to keep them from getting infections, you could wipe out the whole herd of them. Anyway, the fact that we're eating antibiotics every day, there's even antibiotics in our water, is a problem because now we become less and less able to have them be effective. And the last thing is too much unnecessary care. There's a lot of fads in medicine, and whatever they decide to do, almost every doctor's doing the same thing. For example, when I was a kid, every time you got a sore throat, you go in the doctor, you'd have inflamed tonsils. They'd want to take your tonsils out. And then later on, they figured out that tonsils were useful in some ways, and therefore they didn't want to take them out anymore. But practically every kid that I knew growing up had their tonsils taken out. So you see, they do normal operations, or what they call minor operations. They do them on a massive scale. Like nowadays, when people get heart attacks, they do these bypass operations, and they're doing them on a massive scale, and then they'll call it some kind of minor surgery, like it's a minor surgery to crack you open like a cracked crab, and then clean you out and change the flow of the blood going to your heart. Anyway, all these things are crazy, and they're problems that we continue to face. Number two is why is the cost of healthcare so high? The first thing I would say, one of the reasons it's so high is because it's profit driven. There's a profit motive with little or no competition. Example would be the drug companies. They can charge whatever they want for a drug, whatever the drug is, because basically they have a patent on the drug, and it doesn't go, it goes for a long time. That's why they advertise on TV, because they have to sell those drugs during a time when they've got the patent, because because after a certain period of time, 10 years or whatever the patent is given for, then it becomes a generic drug. Any other company can produce those drugs, and therefore they'll make less money. It won't be that they'll stop making money, they'll just make less money. The second thing is that doctors are mainly into testing drugs and intervention, not prevention. This drives me crazy, that doctors don't care about what your lifestyle is. They could care less. I mean, they might ask you if you smoke or not, but because insurance companies ask that. But when you go in, the first thing they want to do is they don't want to make any judgments about what's wrong with you. So there's no prognostication about what the problem is. What they want to do is take tests, and those are expensive. And then they want to give you drugs, and if that doesn't work, then usually a general practitioner will send you to some surgeon or some other specialist. Anyway, so there's no concern or no interest in lifestyle and all of that kind of thing. I mean, it's changing a little bit now. Some doctors are getting into that, but for the most part, they don't really ask you what you're doing in terms of prevention. Actually, in our world, prevention is really testing. Early testing is their idea of prevention. But I'll talk more about that later. Another thing is they overprescribe tests and drugs and all of that. One of the problems of the opiate epidemic in the United States is the fact that we overprescribe these painkillers and other opiate drugs. It isn't just opiate drugs that are, the illegal stuff like heroin. It's the prescription drugs, and then what happens is people take these drugs because they want to get rid of pain, and then they get hooked on them, and then before you know it, it's a real problem. Another problem, or cost of high cost of medical care, is that we have too much specialization. Almost everybody focuses on one organ or one part of the body or one kind of specialty, and the argument is that it's too much to know, to be a general practitioner, to know everything about medicine. So you should know just something about a particular part of the human anatomy. For example, I have to go when I had a retina tear. I had a tear in my retina, actually happened in different times in both eyes. I had to go to a retina specialist. So that's somebody who just focuses on the back of your eye. They don't pay any attention to the rest of your eye, just the retina. And so we're into that. It isn't just that you have doctors that focus on eyes or ears or nose or whatever. It's a certain part of an organ, like part of your eye. So these retina specialists, that's all they do. They work on retinas. Another problem is, of course, no one's looking at the big picture. No one's looking at your overall health. When I go to the retina specialist, that retina specialist is just interested in my retina. He doesn't care about the rest of my eye nor the rest of my body. And that's sort of crazy if you think about it, because health is affected by a whole bunch of things, even eye health. Actually, eye health is affected by your diet as well. The last thing is that why the cost is so high is because we treat the symptoms and never the causes. All the things you get, whether it's testing or drugs or whatever, it treats the symptoms of the problem, not the causes. So we never know for sure what the causes are, unless it's something obvious like type 2 diabetes. Type 2 diabetes is the result of people gaining too much weight. And so if we were to put them on diets and took time to deal with the repercussions of losing the weight, we would be treating the cause. But instead of doing that, we have drugs that people will take, insulin that they'll take, or some other drugs to try and deal with the problems that they're facing, which are the symptoms. Number 3 is, what's the government role in healthcare? Well, you've got these certain populations. Let me put it this way. Certain populations are covered, or partially covered is more accurate, partially covered in the healthcare system by the government. In other words, the government is paying a portion of the healthcare for certain groups in the population. And that includes Medicare, which covers the older people, so you got to be 65 or older. Medicaid, which covers the poor. Veterans and disabled are covered under certain aspects of Social Security. And federal employees and members of Congress are covered by given some health care benefits by the programs that are designed for those populations. So it's old people, poor people, veterans, and public employees that are covered. Everybody else has to get private insurance on their own. And keep in mind that none of these systems, Medicare and so on, are really substantial in the sense that they cover really a person's medical needs. For the most part, you have to supplement, like I said earlier, you have to supplement, and you have to supplement heavily. For people who are older and just living on Social Security, it's an enormous problem of paying for the drugs and hospital stays and whatever else happens to them as they get older. Okay, and the last thing is, what can we do? What can we be done about it? One suggestion, of course, is a different mode of financing, such as a single payer, or looking to, socialized systems, like Western Europe, where the government pays as a single payer, pays for everybody. We talk about in the United States as like putting everybody on Medicare, like that's really going to solve it. But anyway, that's one suggestion. The second thing is a focus on prevention. And here, this is where I would definitely focus my attention. I'm getting older, so I pay a lot of attention to these things. And what do I mean by prevention? I don't mean what doctors mean, which is my next point, which is tests and vaccines, early testing as prevention. Like, for example, for everybody on Medicare, the Medicare system will pay for and encourages people to get flu shots. So you get like a vaccine, and that's supposed to prevent you from getting the flu. Well, that's not really going to work because there's many strands of the flu, and the test only covers some of them, and you're still likely to get the flu. Anyway, that's their idea of prevention. My idea of prevention is number 2 here, the focus on prevention, which is diet. Everybody should be on a plant-based diet, stop eating animals, because they're a source of problems in people not only maintaining a decent weight, but also the problems in factory farming, as one of them I mentioned already. I won't go into it anymore, but things like feeding the animals antibiotics, so that when you get an infection, the antibiotics you take have to be stronger and stronger, and oftentimes they don't even work. The second time is exercise, and that second point would be exercise. So diet, exercise. And everybody should be doing some kind of exercise. Probably for most people, walking would be the best thing. And hour a day is probably fine for most people. If you do some kind of rigorous exercise, not just walking leisurely, but walking quickly. And other exercises are probably better. Swimming, running, cycling, that kind of stuff is probably better. But most people can't do that, so the general recommendation would be walking. And there's nothing wrong with walking, it's good for you. Don't smoke, that would be another one. Anybody in this world who's smoking has a death wish. Drinking or taking drugs, that's another thing. The culture drives me crazy when I watch television or a movie and watch people drinking with no side effects from it whatsoever. Even old people can drink, and they don't seem to have any problem with mental capacity. They don't seem to have any kind of hangovers, and they're drinking and taking hard liquor. And there's no such thing as good drinking. Some people think that if you drink wine, that's better than drinking whiskey or something like that. But there's no real evidence of that. And then the other thing is to reduce your stress. Try it as best you can, because we live in a very stressful society. You can't even go out to dinner in our society without a lot of background noise from TVs and everything else that's playing. One of the good things about living in Santa Fe is they don't do that as much as they did in Chicago. As much as I remember restaurants in Chicago playing televisions everywhere around the building, so you can't escape it no matter where you sit. And so you got this white noise screaming at you, and you can't even relax. So, but everybody should do some forms of relaxation, like meditation, yoga, and that sort of thing. Then the next thing is to support alternative methods. A lot of people are beginning to do that, and they have been doing it for some years now, to go to what we would call alternative medicine. And I listed some of them here, like osteopath and herbal medicine, massage, acupuncture, that sort of thing. And the last thing we should do is begin to tell our public officials to focus on food safety. I mean, we see this all the time. It's terrible that food is not safe anymore. It doesn't matter what kind of food you're talking about. There's E. coli, salmonella, parasites all over the place in any kind of food, whether you're talking about fruits or vegetables or meat or whatever. There's these recalls all the time. And that's basically because the government isn't practicing an inspection anymore. There's not enough workers. and all the rest. You know, the government is supposed to be protecting us, and it just isn't living up to its side of the social contract. The fact that we're all drinking bottled water is an indication that the social contract isn't working. So we have to go to our public officials and demand that they do something to give so that we can have clean food. Even if you get organic food, it still isn't going to be real clean because of the fact that those farms are somewhere near conventional farms, and the conventional farmers are doing things like spraying pesticides and herbicides and all that kind of junk. And the end result is that it eventually gets into the water or into the air someplace where the organic farmers are. So anyway, those are just some of the things that we can do. The main thing I would say is take care of yourself. Focus on the second thing, diet and exercise and so on, and step out of the culture, because the culture is just insane when it comes to this stuff. Restaurants giving you portions that 3 or 4 people should eat, and most people watching television all day instead of exercising and so on. Anyway, that's the basis of what I had to say.